but they often do need more than being in hospital or being out.
The doctor is in on the downtown east side. 4 days a week, psychiatrist Bill McEwen hangs his shingle on this park bench when he spots a patient.
So you're saying the new...
Just one second.
Oh, yeah, go ahead.
Hey, Marty. Marty.
He gets to work.
What I was going to ask you is just how you're doing these days.
It's fine.
Yeah? Any problems at all?
No.
No?
He also makes house calls.
Hello.
Heading from one SRO to another.
Hey, Victor.
To help those living with mental illness and addiction.
Are you up?
So they don't end up in hospital.
So how many patients do you have down here?
Oh, a few hundred.
Almost half of the homeless people living on the downtown east side suffer from mental health issues, and many self-medicate and become addicts. And when they need help, they go to St. Paul's.
You know, addiction and what we call our SAMI patient, who are this severely addicted patients with mental illness, is becoming an epidemic, and we're at the epicenter of it here at St. Paul's. Our volumes have mushroomed up something like 160% in the last 5 years.
You know, a week and a half ago, out of 33 beds in Emerge, we had 21 which were psychiatric. And so everything else, infectious disease, cardiology, all gets pushed out. And so we have to take those people out of Emerge.
And the new St. Paul's will do just that. Similar to the Center of Excellence for HIV/AIDS, the new hospital will have an entire team to manage addictions. The key, early intervention.
The whole vision is that we intervene earlier.
Evan Woods believes addiction can be managed. The earlier the treatment, the better the outcome.
The science of addiction medicine is, on the third floor, and in terms of where the healthcare system is, we're still in the basement. So we need to start looking at implementation of these new evidence-based tools, and that's going to take resources.
Resources like this new multi-use facility for youth in Vancouver. Opened only 6 months ago, it's a one-stop shop where troubled kids can go see a doctor, psychologist, or help for an addiction.
I went to treatment for addiction to heroin and crystal meth.
And how old were you when you became addicted?
I became addicted to heroin and crystal meth when I was 20.
Previously, these kids would meet their caseworkers on the street.
I think being able to develop something obviously a little bit bigger for the whole community can have the potential to save a lot of lives.
Dr. McEwen says he'll likely continue to meet his patients on the street, but says a new St. Paul's will help him help his patients sooner, saving lives and saving money.
Thank you very much.
That's it, okay?
Thank you.
Take care.
Randy Neal, Global News.